this video I'm going to discuss about the osteology of the hip bone. You can see this is the hip bone. It is large irregular bone, okay, and this bone, the hip bone, is also known as innominate bone, okay, and this hip bone is formed of it has three parts: the ilium, the upper expanded part is the ilium, then we have inferiorly we have the pubis, posterior inferiorly we have the ischium, okay. So the hip bone is formed by three parts basically, the ilium, the pubis and the ischium, okay. So the this ilium is the upper expanded part of the hip bone, and below we have the two parts, the pubis, which is present antero-inferiorly, means it is present located below and anteriorly, and posteriorly we have the ischium. The posterior-inferiorly we have the ischium. This pubis and ischium is separated by a foramen. Here you can see this is the obturator foramen. This is the obturator foramen which is separating the pubis from the ischium. Okay, now these three parts, the ilium, the pubis and the ischium, they join together at the cup-shaped concavity which is present on the outer surface of the hip bone or the lateral surface of the hip bone. This is known as acetabulum. Here these three bones unite and this cup-shaped concavity is formed. This is known as acetabulum. Okay. Now let's first start with the side determination of the hip bone. How to determine that this hip bone which I am holding is of the right side. So for side determination, you should know some landmarks, okay. That this acetabulum, which I told you that is a cup-shaped concavity present in the hip bone, this should face laterally, okay, and the ilium, this ilium should be superiorly, okay, and the obturator foramen should lie below the acetabulum. So this acetabulum should face laterally, this obturator foramen lies below the acetabulum, and this ilium should be superiorly. So you have to just, this is the hip bone of the right side. Now we will discuss about the anatomical position of the hip bone. How to determine the anatomical position of hip bone? For that you should know there are some landmarks here which you should know. First of all, this now you know that this is the ilium, and the upper end of the ilium is known as iliac crest, and the anterior most point of this iliac crest is known as anterior superior iliac spine, okay. And there in the pubis, this is the pubis. The pubis has a body and two ramus. The body, the upper border of the body of the pubis is known as pubic crest, and just lateral to this pubic crest there is presence of a tubercle which is known as pubic tubercle. So this pubic tubercle and this anterior superior iliac spine should lie in the same coronal plane or a vertical, the same vertical plane or same coronal plane, and the inner surface or the pelvic surface of the body of pubis, this is the body of the pubis and this is the pelvic surface of the body of pubis. This pelvic surface should lie superiorly and backwards, upwards and backwards, slightly towards yourself, okay. And this pubic symphysis, the medial surface of the body of pubis, should lie in the median plane, because you all know that the medial surface of the body of pubis articulates with the medial surface of the hip bone of the other side, and it will form the pubic symphysis. So this should lie in the median plane. So this anterior superior iliac spine and the pubic tubercle should lie in the same coronal plane or a vertical plane, and this pelvic surface of the body of pubis should face upwards and slightly backwards, and this medial surface or the symphygeal surface should face medially. It should be in the median plane. So this is the anatomical position of the hip bone. You should hold it just like this. Okay, this is the anatomical position of the